Hi, welcome to my office. I've been practicing high-quality dentistry here in Greensburg for over 30 years. My goal is to make your visit with us as comfortable as possible. We have blankets, we have sunglasses, earphones, and always a gentle touch. Let's take a look at our office. We have a modern office. We have electronics claim submission. We digitize our x-rays for convenience. So let's take a look at some of my before and after photos. This patient presented with a broken tooth. I made a porcelain fused to metal crown. It has a porcelain collar on the cheek side for aesthetics. This patient presented with a broken tooth. I did a crown build-up and a crown. Kind of enhanced the appearance. This patient presented with badly broken down teeth. This is the after photo with porcelain fused to metal crowns. This patient presented with some bridge work that was failing due to decay. Quite unaesthetic. This is the final bridge that I made for the patient. This is an interesting case. This was very difficult. The patient has an implant supported crown, porcelain fused to metal crown, cosmetic resin bonding, here, here, and here, all blended in very nicely, I think. This patient presented with some bridge work that was 25 years old. There was nothing wrong with it, but it was unaesthetic because of gum line recession. So I redid it with some beautiful white porcelain to match her beautiful white teeth. Other side, same patient, older bridge. Final picture after treatment with the white porcelain. Let's take a look at my lab. Hi again, this is my porcelain lab. This is my porcelain bench. I make my dentures here and also my crown and bridge work. This is my porcelain powder. Porcelain furnace, other tools that I use. This is some cases that I just completed. They just came out of the porcelain furnace. I make porcelain fused to metal crowns. They're the strongest. They've been the standard of care for over 50 years. Let me show you some of my other work. This is interesting. This is an implant supported denture. These are mini implants. This is a model of how it is in the patient's mouth. This is a denture that's been completed. And I'll be filling this with acrylic resin, and it will lock these into place so that they're held in place with these attachments. This is the opposing denture. Notice how cosmetic and pleasing it is. I make my custom dentures so that there's a concavity here so that the cheek helps hold the denture in place. Highly polished so that it doesn't accumulate any debris. The festooning area around each tooth is smooth and polished so stains don't occur, and all in all I think looks very cosmetic. This is another example of acrylic partial dentures. It's a less costly treatment option. It's held in place with wires. Again, this is the opposite appliance. Contrast that to this Sika partial denture. This is held in place with a ring attached to crowns, and underneath the tooth there's a finger that sticks down that snaps and engages into the rings like thusly. It's very cosmetic treatment, and many times this can replace a costly implant placement by using a precision partial denture instead. So all in all, very aesthetic and very pleasing. Let me show you some completed work that I have done for my patient. This is a lower crown. Notice how beautiful the porcelain work is. Chewing surface. Another crown. This is one of my favorites, upper first molar. Again, little different color because the color matches the patient's existing teeth. Chewing surface. Notice the beautiful anatomy. Here we have porcelain fused to metal bridge that was going to be placed in my patient's mouth very soon. Again, very cosmetic and pleasing. Chewing surface. Okay, let me show you something that isn't a trick. After years of research, I've developed a crown that's so strong I can hammer it into the 2x4 block of wood without breaking it. So here we go. This is about the 10th time. How's that for strength? My crowns are so strong I can give a good guarantee. Okay, thank you so much for watching this video with us. If I can be of any service, don't hesitate to call 724-837-9250. Let me show you one final thing. Don't forget to use your ACT fluoride rinse. It makes your teeth more resistant to tooth decay. Do this before you go to bed. And also, my favorite is don't forget to use Stimudents, an interdental stimulator that keeps your gums healthy. All gum disease begins between teeth, so by using a Stimudent or a toothpick, it prevents gum disease. So thank you very much again. Have a great, great day.